it looks very much when you get to the end of it like the vertebral artery test, except you start out with the patient seated. It creates nystagmus and triggers the vertigo episode if people have, BPPV. If they don't have it, then this isn't necessarily going to be positive, or if they have an issue that would be potentially positive because of the vertebral artery test, it might be positive from that perspective. But again, in terms of doing the history, you get that information. So just to remind you, but BPPV, people are going to say, if I turn my head one way or the other, because it tends to be ipsilateral, they turn to the right, they get like 30 seconds, a minute, fairly significant dizzy thing. And then maybe for a couple hours they feel nauseous and punk. And that kind of fades. And so it's related to position. Whereas other causes of vertigo aren't like Meniere's or labyrinthitis. Those things aren't necessarily related to position. So if the person says, every time I look up to go grab it, I look down this way or look that way. So the way that the test is done, you put the person so that they're going to, if the problem was right-sided, they're going to turn to look to the right. And you just ask the patient to let's lay back down. So they just lay down like that, and then you're checking out the, open up your eyes. There you go. So then you're just checking it out. Okay, so that's just the Dix-Hallpike maneuver.
So you just get him into that position.
That's it. And then if you see nystagmus, then that's positive. Like I'm saying, you can have a vertebral artery problem that has nothing to do with the inner ear, and that can be positive as well. But so there's lots of different things that can cause dizziness. But quite often in your intake, you can rule out some of the other causes, right? And also in the lecture, and you'll see this if you go over the notes, Elaine, there's a picture where the woman has like goggles on.
Oh, yeah.
And then there's a computer screen. So they wear goggles with cameras. Okay. And so it measures the nystagmus of the eyeball, and it presents it, or not presents it, but projects it onto the computer screen. So it's much more definitive, and you can get probably like more specific. Yes, there is some rotatory or horizontal nystagmus here in relationship to that. Just doing it this way is not necessarily as definitive or I can't think of the right word, more technological. And this is more kind of functional. But in any case, you get that information. So and typically speaking, the Dix-Hallpike maneuver would be done separately than the correction for the BPPV. It's just that I'm going to be kind of doing them all at once now. But so if you were going to do a correction for the BPPV,